Well, at this point, I want to move from our new initiatives to provide a little background on what the department has done over the last 5 to 6 years in the area of preventing healthcare-associated infections. Next slide. Without question, the department has been committed to reducing healthcare-associated infections for the last several decades. However, this report, the GAO report on healthcare-associated infections in hospitals, helped to rekindle our interest, refocus our efforts on reducing these infections. As you can tell from the name of this particular document that was released by Congress, it was felt that we could do more to provide leadership, national leadership, and national dialogue to reduce these infections. Next slide. If you read the 80-page document, the GAO report, you would see that there were areas of recommendations for the Department of Health and Human Services. Certainly one of the central themes of their criticisms and recommendations was that we needed to improve our central coordination of all HHS activities to ensure that what the various operating divisions, Center for Disease Control, Agency for Healthcare Research and Quality, the Center for Medicaid and Medicare Services, and others, that all those efforts are working in a concerted fashion to reduce these infections nationally. They also encouraged us to identify priorities among the CDC guidelines to reduce these infections, to really promote implementation of the high priority practices among those guidelines, and that we needed to consider inclusion into the CMS conditions for participation, some of these high priority practices enumerated in the CDC guidelines. The third area of recommendation was that we exploit health information technology maximally to reduce these infections, that through health IT we can reduce these infections, and that we needed to use health IT to increase a reliable national estimate of healthcare-associated infections that would benchmark our success and our progress moving forward. Next slide. Out of this GAO report, a senior-level steering committee was created by the Deputy Secretary to focus on reducing these infections nationally. And this resulted in a national action plan to prevent healthcare-associated infections, really a roadmap to elimination. Next question. Next slide. When the senior-level steering committee was created, it was charged with developing an action plan to reduce, prevent, and ultimately eliminate healthcare-associated infections. We were further asked to establish some nationwide goals that would benchmark our success and serve as a report card on our efforts moving forward. We were instructed to improve our central coordination to ensure that we leveraged all the resources that the department has at its disposal to reduce these infections, and we were encouraged to engage partners both within the federal family and external stakeholders to help maximize our efforts across the nation. Next slide. The action plan the initial action plan that focused on acute care hospitals was released in final form in June of 2009. We were committed to maintaining this document as a living document that would be revised and updated periodically to reflect the evolving science and the identification of strategies that are most successful in reducing these infections. And we've hoped that it served as a national roadmap to efforts to reduce these infections across the nation. Next slide. As I mentioned, the initial action plan that was released in June of 2009 focused on acute care hospitals only. And furthermore, we limited our efforts to the major causes of healthcare-associated infections: catheter-associated urinary tract infections, central line-associated bloodstream infections, surgical site infections, ventilator-associated pneumonia, and 2 organism-specific infections, that of Clostridium difficile and methicillin-resistant Staph aureus. Later in today's presentation, you're going to hear more about our efforts to reduce these infections in the highlighted areas of central line-associated bloodstream infections and methicillin-resistant Staphylococcus aureus. Next slide. As I mentioned, we were asked when we were given the original charge to create a report card or create some national targets that we could follow moving forward to benchmark our success and to see if we were moving in the right direction. To that end, a stakeholder group that included governmental officials, academia, and individuals in the private sector met in September of 2008 to set some ambitious but achievable goals to reduce these infections, and those are listed on this slide. A 5-year reduction in central line-associated bloodstream infections of 50%, of invasive MRSA infections of 50% reduction, a surgical site infection of a 25% reduction over this 5-year period of time. We recently met to review our success to date to see if we were on track to meet our 2013 targets. We were very pleased to learn that we are on track to meet our 50% reduction in central line-associated bloodstream infections, that we were on track to meet a 50% reduction in invasive MRSA infections, and that the process of measures associated with Surgical Care Improvement Project out of CMS were on target for adherence to those recommendations. We learned that we still have work to do in the area of Clostridium difficile infections that seem to be continuing to emerge. And although a significant progress has been made in reducing surgical site infections, we were making progress, but not quite to the extent that would allow a 25% reduction over 5 years. So overall, we're moving in the right direction, and there's still data on some of these infections that will help garner our progress moving forward.